Welcome back. 9:14. When we focus on lung health, so often we think of older people with issues from illness or smoking. But there is a new study that's trying to determine the effects of everything from COVID to alcohol and how it is affecting the lung health of 25 to 35-year-olds. Mercedes Carnathon from Northwestern University joining us now to discuss the importance of this study. Good morning. Great to see you again.
Good morning. It's nice to see you talking about prevention.
Yeah, so let's talk about that. Why do this study? What's the purpose of it?
Yes, we're really excited that the National Institutes of Health saw value in establishing a cohort of young adults at the time of their peak lung health so that we can study the factors that are related to them maintaining ideal lung health throughout their life course.
Okay, so peak lung health then is that age group, that 25 to 35, and I understand that it's a 5-year study. And tell us what exactly you're evaluating. I kind of mentioned it at the top here, but what is it exactly you're looking at, and what are you hoping to get out of that?
Yes. So the reason we chose the 25 to 35-year-old age group is because that's the age at which adults reach their peak lung health, when their lungs are the strongest and the healthiest. And the things that we know that influence the achievement of peak lung health are factors such as physical activity, whether or not one smokes, specifically not smoking, um, environmental pollutants, and other factors throughout the life course. So, what we're going to do is measure all of these things in young adults who are 25 to 35-year-old and follow them over time. The initial study will be 5 years, but what we really hope is to get contributions from these young adults who are going to contribute to what we don't know about how to maintain healthy lungs and healthy breathing throughout the lifetime.
So it's all about trying to figure out the best way for prevention. You know, over time, we've been hearing a lot about people who have lung issues that aren't smokers, and you can't pinpoint what might have caused the problem. Is this study going to hopefully help you guys figure that out?
Yeah, that's really the goal. Right now, 3 of the top 10 leading causes of death have underlying issues that are related to the lung. So it's chronic lower respiratory lung disease, it's COVID-19, it's influenza. How is it that we can help adults avoid this? And part of that is so that we can identify health behaviors so that people know to promote those health behaviors, possibly healthy diets, maintaining a normal weight, being regularly active, sleeping well. These factors, including, pollution. There's a lot of enthusiasm and interest in climate change and in our air quality. If we can establish direct links between these many behavioral, environmental, and social factors and their influence on lung health, perhaps some of these respiratory illnesses can drop out of our top 10 leading causes of death.
Okay, we are out of time, but very quickly, what's the website people can go to if they'd like to be a participant?
Yes, go to the American Lung Association website, and there is a lung health link that you can sign up and see if you're eligible. So
All
thank
right.
you for this opportunity.
Mercedes Carnathon, always a pleasure to have you on. Best of luck with this
Thank
study
you.
at Northwestern
Take
University.
care.
Okay.